On behalf of the CBMS network, we welcome all of you to the session on generating local-level data for more informed policymaking using the community-based monitoring system. We would like to welcome our speakers and the participants who are watching via Attendify. I'm Celia Reyes, President of the Philippine Institute of Development Studies and leader of the CBMS International Network. First, let me provide you an overview of the session as well as the monitoring system that we will be featuring in this session. This session showcases how the adoption of the CBMS methodology can complement existing national statistical systems in filling in data gaps at the local level, and how local governments can be capacitated in generating local-level poverty statistics useful for more comprehensive needs assessment and prioritization, focused program action, and impact monitoring over time. Specifically, it features presentations on how CBMS can address crucial data gaps and requirements for design of appropriate policies and interventions, more focused targeting and impact monitoring in the context of the Sustainable Development Goals agenda and implications of the COVID-19 pandemic. Let me just have a few reminders for the session participants. Questions about the presentations can be raised at any time through the Attendify chat box for the duration of the live session. Please state your organization and for whom the question is being addressed. Questions will be answered after the presentation of the panelists. Additional inquiries about the presentations may also be forwarded to the CBMS network email after the session. And for further applications of CBMS, we also encourage you to visit the booth at the 2020 UN World Data exhibition platform in Attendify. The community-based monitoring system is a tool initially designed to provide policymakers with good information base for tracking the micro policies and policy shocks, particularly on the vulnerable groups in the society. This project was initially supported by the International Development Center of Canada. Development Research Center of Canada. CBMS was first developed and pilot tested in the Philippines in 1993 and has been adopted in local contexts in more than 20 countries in collaboration with partners from the government, academe and research institutions, non-government organizations, and development partner agencies. The pilot testing in the countries was through the CBMS Research Grants Program of the Partnership for Economic Policy. Development and related capacity building activities and the implementation and applications of the CBMS methodology and tools are spearheaded by the CBMS Network Office based at the Angelo King Institute of De La Salle University in Manila, Philippines. So what is this CBMS? What are the key features of the community-based monitoring system? One, it involves a census of all households in a community using a structured set of tools and training modules. It adopts the official concepts and definitions used by the national statistical offices. Two, local government unit-based while promoting community participation. This ensures sustainability of the system. Three, it taps existing LGU personnel or community members as monitors or data collectors to make the system inexpensive to operate. Fourth, it generates a core set of indicators that are being measured to capture the multidimensional aspects of poverty. This allows us to determine the different deprivations being experienced simultaneously by the households. Five, it uses freeware customized for CBMS data collection, processing, and poverty mapping. And finally, it establishes database at each geopolitical level so that data can be used at different levels of government. CBMS makes use of advanced technologies. A tablet-based data capture system has been developed called CBMS Scan for more efficient collection of data, and data is then submitted online to the CBMS portal. Locations of households are also obtained through GPS readings. A data processing system called StatSimPro has also been developed to help local government units process their data. Indicators are automatically computed and tables are generated which can be copied and pasted into Word or Excel files that makes it easier for the local government units to prepare reports. QGIS, a freeware, is used to present the data in maps to assist decision makers identify areas that need to be prioritized. Because it is a census, all households in the community are included in the data collection, and therefore the adoption of the CBMS generates the necessary local level data and their desired disaggregation. Some of the disaggregations are household and individual data by age, sex, sublocation, income class, and other socioeconomic and demographic characteristics. It also generates data for vulnerable groups such as children, youth, women, elderly, persons with disabilities, and indigenous peoples, among others. It can also generate SDG indicators at the lowest administrative level. What are the applications of CBMS? CBMS can be used to prepare local development profiles and plans. It can be used to design, target, and implement programs and interventions. It can also be used to undertake policy analysis and impact assessment in the context of various thematic concerns, such as multidimensional poverty analysis, bottom-up planning and budgeting, gender and development, migration and development, disaster risk reduction and management, climate change impact and vulnerability assessment, monitoring child labor, localizing the MDGs and the SDGs, crisis response and mitigation, and impact monitoring. One of the biggest challenges in monitoring the SDGs is the desired level of disaggregation. The SDG core principle of leaving no one behind requires data disaggregation at the lowest administrative levels by sex, age, ethnic groups, disability, and so forth. With limitations of the data with regards to granularity, availability, and access that can be generated by existing national statistical systems, and the high cost of conduct of national surveys, the CBMS can be adopted to generate the necessary data to track subnational level progress in the achievement of the SDGs. CBMS complements the existing national data ecosystem by addressing data gaps for better needs identification, more comprehensive analysis, and design of appropriate programs and interventions. CBMS provides the necessary disaggregated data to know the status of and disparities among communities, households, populations in meeting the SDGs, identify and assess needs, and prioritize programs. CBMS generates data that identifies the who, the where, and the whys of poverty. Thus, it facilitates a more comprehensive analysis of the development situation and the design of appropriate policies and interventions. Since CBMS is designed to be conducted regularly, it generates panel data and therefore provides valuable data for monitoring and evaluating impacts of programs on target outcomes over time. In terms of coverage in the Philippines, CBMS has been implemented in 78 provinces, 36 of which are province-wide, covering 1,111 municipalities and 113 cities, covering 31,426 barangays since 1999 to present. Recently, the CBMS law was enacted, institutionalizing CBMS in all cities and municipalities in the Philippines. CBMS has also been pilot tested in selected sites in 29 countries in Asia, Africa, Latin America, and North America. So for this session, we have invited two of our CBMS researchers who have pilot tested CBMS in Ghana and Botswana through a research grant from the CBMS program of the Partnership for Economic Policy. We also have with us two former mayors in the Philippines who have implemented CBMS during their term of office. One of them has moved on to join the House of Representatives, and the other is now a senator in the Philippines. So we'll now proceed with the presentations. And for the first, we have a presentation from Ghana. Dr. Wilhelmina Quay, Director of CSIR, Science and Technology Policy Research Institute in Ghana, and is the team leader of the CSRI CBMS research team. Dr. Quay obtained her PhD in rural sociology from Wageningen University in the Netherlands. She also has a certificate in gender mainstreaming from the Institute of Capacity Development in South Africa. Friends, let us listen to Dr. Mina Quay.
Yes, so presenting on generating local level statistics for more informed policy making, use community-based system, the relevance of it in times of COVID. By way of outline, I would talk about the importance of data in times of COVID, the CBMS experience in Ghana, and application in the voluntary national reporting system. For importance, data gaps at the community level, despite decentralization that we have here in Ghana, it's an issue. And also the issue to do with time lapse. Data is needed to generate impact of interventions over time and to contribute to SDGs reporting. Data across different parts of the world is also very important, and that will help us to compare results. The experience that we had here under the Partnership for Economic Policy, the community-based monitoring system we'll share is on the Atebubu Amatin district in Ghana with data between the 2020 and 2020. And this was a tool for the opportunity to take charge of their planning based on census data. These are we had to redefine all the 17 goals in our system, and data that ought to be collected using the CBMS was disaggregated by sex and urban, rural geography areas, as well as household characteristics. We collected data on all the 17 goals. Here is a slide showing some of the results that we had with the data collected on all the 17 goals, giving us proportions of the responses that we had. This again is showing us the proportion of population that we dealt with that were below the international poverty line by age, locality, and sex. For all the communities that were visited under the district, we have the information calculated by men, female, and also the underprivileged. I will zero in now on work that we did to contribute to the voluntary national review report that for Ghana. And here we looked at the synergies. The CBMS team had the opportunity to conduct the synergies across the SDGs, and it was a national consultancy for the National Development Planning Commission. The specific issues that we covered, first we assessed the progress for SDGs 6, 7, 9, and 11, and also we looked at the synergies between all the SDGs, and we made recommendations for policy making purposes. This is the synergies between SDGs, and I must say that the SDGs are really very much connected. Once you tackle one, you have the rippling effect on the others. And to avoid duplication, there's always to have a clear picture of the synergies and the policy coherence. The CBMS tool demonstrated the inclusivity in gathering data on the existing capacity, poverty dimensions, resources at the local level for bottom-up planning that seeks to create opportunity for encouraging inclusivity. Together with local stakeholders, data was collected at the households and their members on the various indicators such as access to shelter, access to energy services, access to water, among others. And this ensured inclusivity in getting to the people who actually need services and people who actually need intervention. Results from the CBMS informed community leaders with relevant data for monitoring their local development progress, providing input for local level planning, promoting transparency and accountability. Here they are showing you some of the indicators for multiple poverty dimensional data collection. And we looked at nutrition, child mortality, years of schooling, school attendance, cooking fuel, sanitation, water, electricity, and access to housing. These are the dimensions that go into poverty measurement. And poverty, I must say that it's not just one single dimension, but it has multi-dimensional. It is multi-dimensional. So this offered us, the CBMS tool offered us the opportunity to collect data, and this PMI be used for different purposes to determine poverty beyond just income-based lists. Again, this is showing us the sample size of close to 3,000 that we reached in 20 communities in the Atebubu district that we did the work in. The result for the PMI is showing in graphs, giving you the indicators for the proportions. You realize that when it comes to sanitation, for example, we have a lot of percentage not having access to good sanitation. So this is an area where we need to focus. And I must say that at the national level, yes, we are deficit in data on sanitation, and CBMS will offer you the opportunity to be able to collect such data. These are some of the maps that we generated. For example, this is showing population or the proportion of the population who have access to sanitary and toiletry facilities. I must say that the green is showing those with access and the red is showing those without. So if you want to do targeting for intervention purposes, effective intervention, you go into the communities that are spotted red for effective targeting. Again, this is a map showing the population with safe drinking water. Again, the red are without and the green are those with access. So all the red spots are the areas where you have to target when it comes to interventions. Again, access to electricity, it's also was also generated to show you where to do effective targeting. Now, we realize, for example, the SDG 1 has synergies with a whole lot, the SDG 2, the SDG 3, the SDG 4. So once you are tackling poverty, you know that zero hunger is being targeted, good health and well-being, quality education is also being targeted. So this show you the synergies so that you could avoid duplication of effort. And it's very good for sectorial interventions. This is a graph showing some of the vulnerables that we need to look at. And CBMS would offer us the opportunity to locate some of these vulnerables for effective targeting, making sure that nobody is left behind. It is clear that achievement of SDGs cannot be attained through silo initiatives, with careful consideration to interactions and interlocking processes among the SDGs within various targets. Reporting on the synergies require time series data for qualitative to complement the qualitative, quantitative to complement the qualitative narratives. Availability of an easy access, reliable and credible data should be integral part of report. Again, gathering massive scale and analysis of data requires investment in technology for effective data collection, analysis, storage, and management. Localizing the SDGs means implementing local agendas in communities to ensure that no one is left behind. The use of the community-based monitoring system should be promoted to facilitate data collection for gauging progress by local planners and stakeholders at the local level, especially. Concluding, I will say that the CBMS is not just a data collection tool, but also has added advantages, such as empowerment through local capacity building in the communities and key stakeholders to actively engage in database need identification and analysis, and also prioritization of planning to address these needs. This has been adequately demonstrated, not just in Ghana, but also elsewhere like Togo, Kenya, and Uganda, who were part of the PEP project. In the context of this current challenge of the COVID, the government of Ghana will need data on the most vulnerables that are open to shocks. For example, the poor, the informal sector workers, and other relevant population subgroups for the design of safety nets and also social protection policies and programs to mitigate the impact of future similar COVID crises, while at the same time ensuring that the achievements of SDGs are met. For my contact, I work with CSIR, Science and Technology Policy Research Institute. You can reach me on +233 020 8132 401, and my email is kwewahomina@yahoo.com. Thank you very much for your attention.
Thank you, Dr. Kwe. At this point, let us turn now to our colleague from Botswana. Dr. Happy Sifambe is a professor of economics at the University of Botswana, where he has been based for the last 33 years. He is the research team leader of the pilot CBMS initiative in Botswana, has extensive experience in the areas of labor economics, wages and incomes policy, and public policy analysis, as well as in quantitative methods. He's currently the acting deputy vice chancellor for academic affairs at the University of Botswana. He's a member of the National Strategy Transformation Team of Botswana, appointed by the President of the Republic of Botswana in 2019. Friends, let's listen to Professor Happy Sifambe.
This is a presentation on implementing CBMS in Botswana, relevance to informed policymaking and monitoring and evaluation, the case of Habani village in Botswana. This presentation is an outcome of a research that was done by a team of experts based in the University of Botswana in 2018. The presentation follows with some highlights, basically looking at Botswana's history. First, Botswana has virtually been one of the only countries that has sustained rapid economic growth over an extended period since its independence in 1966, which allowed it to be transformed from the poorest country to being an upper middle income status by 1990. From much of the post-independence period, Botswana has recorded growth rates in the region of more than 10% on average, of aid in tigers such as Thailand during this period. The growth rates were facilitated by mineral growth, which was carefully nurtured by disciplined fiscal and monetary policy. Unfortunately, the high growth of the economy is not matched by the increase in jobs, which is partly due to growth, growth of the mineral sector and due to its capital-intensive nature. It is also rather matched by high income inequality and poverty levels that are not befitting an upper middle income country of Botswana's stature. If you look at Botswana in terms of where it's going, it's virtually not balanced in terms of its growth. In terms of the work that we did and its relevance, given this development, Botswana has, as a way of dealing with those problems, initiated a lot of activities around the issues that are anomalous, that include poverty, hunger, education, gender inequality, water, sanitation, and environment and social justice. These aforementioned problems led to the localization of SDGs by the country, which highlighted the impact, role, and intervention of institutions and participants in Botswana. The SDGs have been aligned to the national development frameworks, which are expressed in terms of Botswana's Vision 2036 and the 11th National Development Plan, National Development Plan 11. The key challenges of government that government faces in implementing the SDGs are, mainly the absence of high quality disaggregated data that can allow the country to design targeted progress, the development challenges. Our study of Habani village used CBMS data, which made it possible to better identify the needs of the people in Habani and be able to propose relevant policies to local development and thus favor the achievement of sustainable development goals. The data also complements data from National Statistics Unit, which is Statistics Botswana, which produces data that is very infrequent and is also not very disaggregated. This research was the first of its kind to offer an analysis for monitoring and evaluation of SDGs with a theme topic on youth unemployment determinants. The CBMS data was also used to model and produce policy relevant results on youth unemployment, especially with regards to labor market transitions. Many studies that were carried out on youth unemployment and unemployment in general in Botswana did not examine the gross transitions and the transitions determinants as determined by individual socioeconomic characteristics. The data that was collected for CBMS useful for SDG indicators for different disaggregated parts of the SDGs, which include household income, food security, education completed by gender and age, access to health facilities and number of deaths per thousand, access to safe water, sanitation, electricity, decent housing. Additional data on employment and changes in employment status over time was also collected for the thematic study on youth unemployment. This information is collected at the lowest disaggregated unit of the economy at ward or council level. The information generated from the questionnaire that was made for this purpose is useful for generating poverty data by gender and by council ward. And if you look at it, it's also useful for poverty indicators at disaggregated level, unemployment rates, access of Botswana to government employment programs, and training by gender and age by disaggregated level. And when you look into the next slide, you realize that we have been able to use this data to generate poverty incidences that show that if you look at poverty, for instance, it's calculated at 12%, and it's 16% at national level using the national poverty data line, which is quite, something that has never been done for that disaggregated level. The next slide shows access to basic services such as water, sanitation, and again, you can see that Botswana is doing very well, Khabani in particular, in terms of access to basic services. And the next one shows how households access one of those services, which is electricity. And you can see in terms of putting it in graphical forms, the red dots show where there is no access and the green ones show access. And you can see by the different wards in Khabani where the concentration is, which allows government to really be able to see where to intervene if they have to. The next slide talks about the findings from the unemployment from the data. And using the Markov and multinomial logit models, we found results that are quite revealing in terms of policy, showing that being male increases your chances of remaining employed compared to being unemployed. Being older also increases your probability of finding a job. Also, being older reduces chances of exiting labor market. And it also suggests that education increases your transition probabilities. And participation in government programs also increases your chances of getting employment relative to becoming unemployed. And unfortunately, it was very few that have participated. And last but not least, in terms of policy implications, the implications of this information is that government needs to expedite employment creation policies and reform education. There's also needs to come up with more gender empowering programs geared towards reducing the gender gap in the labor market. And there's also need for education and training to infuse practical training skills and leadership for graduates. And there's lastly also a need to publicize government youth programs and simplify the program form and other qualification criteria for funding. In terms of scaling up, a key challenge of Botswana's economy, as indicated earlier, is lack of good sound policies, which are not matched by performance and impact because of weak monitoring and evaluation. The big challenge of M&E is lack of disaggregated data to do the M&E, and scaling up of CBMS will therefore improve the country's performance in terms of M&E, and especially for SDGs. And this can be facilitated by collecting data requirements and indicators for profiling and so forth. One of the key challenges, or one of the key lessons learned from CBMS in relation to COVID-19 is that if you look at Botswana's issue or way of dealing with COVID-19, it was difficult when we had to separate different kinds of individuals for support during lockdowns for COVID-19. In April 2020, for instance, when the country went into lockdown, it was not easy for the country to know who should be supported and who should not, because there wasn't that disaggregated level. So at policy level, there was an agreement that vulnerable, such as unemployed, and the informal sector and the youth were to be supported with food and other necessities. But it was not easy to find them out. So unfortunately, because of lack of disaggregated data, it was impossible to differentiate the vulnerable groups and needy from those who did not need the assistance, which led to a total mess of the situation in terms of provision of the needed support. So therefore, they merged a targeting problem with those who were benefiting, who should not have benefited, and also those who should have benefited, some of missing because of targeting, and therefore missing on the food hampers and other necessities. So going forward, if we fully implement a CBMS generated data, it could be very good in terms of assisting the government in identifying households and individuals who need to be targeted for assistance. This is also quite useful in terms of general social safety nets, even under normal circumstances and not just during COVID-19 situations. So this, if it is something that we do and make available countrywide, would help in terms of policy implementation, targeting of programs, and monitoring and evaluation. So very much the presentation will be questions and answers in the next section. Thank you very much.
Thank you, Dr. Sifambe. So we have heard from two CBMS researchers. Now it's time to hear from two policymakers. And right now, we'll be hearing from Congresswoman Dalia Loyola, who's a member of the Philippine House of Representatives in the 18th Congress, representing the 5th Legislative District of Cavite. Representative Loyola has a degree in medicine from the University of Perpetual Help in Binion, Laguna, and had been practicing her profession before she entered public service. She was the local chief executive of Carmona, Cavite for 12 years before holding a seat in the Philippine Congress. As a former local chief executive for many years, the municipal government of Carmona has received numerous awards and recognitions for various development initiatives. Representative Loyola has adopted and used the community-based monitoring system for planning and program implementation in the municipality, which resulted to smooth, harmonious, and successful programs and social missions. Let us now listen to Congresswoman Dalia Loyola.
Good morning. The community-based monitoring system has been a perfect tool in producing relevant information for investment prioritization and program implementation of Carmona. CBMS data has served as one of the inputs to most of the LGUs plans and policies. The system helps in providing a more nuanced view of Carmona's population and its needs. Through CBMS, Carmona was able to use a more comprehensive body of data to implement relevant programs and policies effectively utilizing its limited resources. CBMS helped in generating maps showing critical facilities such as schools, daycare centers, barangay halls, and others. This in return helped the formulation of the climate disaster risk assessment and the disaster risk reduction management plan. These were then incorporated in our comprehensive land use program, comprehensive development plan, and other development plans. Also, CBMS become crucial in the identification of overseas Filipino workers and their dependents' needs. This enabled the formulation of migration and development programs such as the school-based program for children of OFW and the Baling Bayan Portal. From 1990 to 1995, the local government used secondary data from the national government agencies. Meanwhile, from 1996 to 1999, the municipality used the Municipal Survey Questionnaire, a 2-page questionnaire based on the social reform agenda, minimum basic needs. At that time, the MPDC staff who acted as data enumerators manually processed the gathered data. It was only in 2000, from 2000 until 2007, that the local government used a spreadsheet software for faster information processing. We started adopting the CBMS in 2008, first with the paper-based application, and then the tablet-based application on 2014. This year, we are already in our 5th round of CBMS implementation. The data from a 2-pager questionnaire based solely on the projections made by the national agencies was not enough for the municipality to effectively provide relevant services to those who needed them most. With the adaptation of CBMS, the gaps were addressed, and it also helped our LGU to improve its planning, budgeting, and program implementation processes. Through CBMS, a clearer picture of Carmona's population and needs became possible. With the continuous implementation of CBMS, we were able to make sense of the sectoral data through the years. This data became crucial in 2 ways. First, on the assessment of the condition of different sectors, and second, in measuring the extent and causes of poverty in our municipality. In light of this, monitoring and evaluation of existing programs have been made possible. Through the years of CBMS implementation, we were able to improve the situation of various sectors, which contributes to the achievement of the SDGs. An example would be the decreasing rate of households with income poverty below the poverty threshold. Also, households below the food threshold likewise showed a decrease. Also, CBMS data shows that there is a significant decrease in the unemployment rate, and also underemployment rate decreased from 27% in 2014 to 15% in 2017. These decreases validated the effectivity of the LGU's poverty reduction programs. These programs were aligned to 2 SDG indicators, 1 and 8, which aims to alleviate poverty by providing citizens with job opportunities through livelihood programs. Example of these are the ecobac production, Gupichinelas, Pato production, Unlat Pangkabuhayan Pedicab, and financial assistance as a startup or continuous capital. We were able to identify the problem of informal settlement. In 2011, it was seen that there are 921 informal settlers in our municipalities. To deal with this, it is of paramount importance to define the root cause of the people's plight, determine their location, and identify the effective approach for their relocation. These findings paved the way for the birth of Purok Kalinga, a relocation program with integrated social services. This aims to effectively address the issue of informal settlers in our municipality. We allocated a 4-hectare lot in Paligawan, Matanda as the relocation area and provided those who were relocated with basic infrastructure facilities such as the water supply system, electrical utilities, schools, health centers, and more. We relocated more than 400 households in the relocation area and provide them with pre-construction materials for their houses. Through this effort, we were able to reduce the number of informal settlers by 47% and makeshift houses by 18%. In connection to this, the decreasing number of households living in makeshift houses was also observed by the LGU for the past 4 rounds of its CBMS. From 1,234 households in 2008 to 556 in 2017. With CBMS, we improve our services to PWDs and cater other PWDs in the community through the Community-Based Inclusive Development Program. Under the Work Placement and Livelihood Program, the LGU referred some PWDs to various companies and agencies. PWD inclusion in the workplace was institutionalized through Municipal Ordinance 11-2019. In that year, 104 PWDs were hired by private companies, while 17 were hired by the local government as job order employees. On the other hand, PWDs in the municipality also engage in livelihood activities such as paper mache, tofu making, food processing, sewing, and many more. Some of them were working under PWD support groups such as the 4K, Pidosi, and Senyasi. In 2011, we added a rider questionnaire on smoking, which basically asks about the incidence and frequency of smoking in households. With this, the LG learned that 64% of households in Carmona have at least one smoker. This means that 12,500 households or 50,000 individuals are exposed to the hazards of smoking. This led to the creation of Municipal Ordinance 009-11 and the Smoke-Free Carmona campaign. Information campaigns were initiated, and among these are the creation and conceptualization of ordinance primers, printing of graphic health warning tarpaulins, and no smoking stickers and public announcement. These were disseminated to different sectors. Other notable programs implemented are the smoke-free homes and the direct access to healthy lifestyle intervention and advocacy. Based on the Municipal Health Office historical reports, there is a decrease in the incidence of chronic obstructive pulmonary disease, which is known as one of the leading causes of mortality in Carmona through the years. Despite the lack of a national comprehensive database that can be used in crises like the COVID-19 pandemic, through the CBMS, the local government distributed each subsidy to more than 13,000 plus households in Carmona under the Social Amelioration Program of the Department of Social Welfare and Development. Target sub-beneficiaries such as the indigent families, senior citizens, overseas Filipinos, underprivileged sector and homeless citizens, and informal economy workers were identified using the CBMS. A panel data was generated as basis for their assessment. CBMS had significantly helped in preventing any duplication of household beneficiaries. This proved to be vital in maintaining the reliability of LGU response during precarious situations such as COVID-19 pandemic. We need to strategically maximize the use of CBMS in implementing and providing programs, especially in our battle to COVID this pandemic. With the capability of CBMS and the technical staff of our local government unit, we were able to track down the location of our vulnerable sectors. This helped to facilitate the efficient distribution of relief goods, medicines, other health services and assistance, as they are not allowed to go out in the community during the time of the quarantine. CBMS can also be useful in improving other databases. In Carmona, the combined insights from the CBMS and the rapid earthquake damage assessment system gave the local government unit a better view to effectively reduce risk in our municipality. An example of this, in 2011, through CBMS, we were able to identify and locate 13,555 households in 13 barangays that were affected by flooding. With the effective implementation of the disaster risk reduction, climate change adaptation programs, we were able to decrease this number to 28 households spanning only to 2 barangays by increasing our flood control programs. To further improve the utilization of data on policy formulation, implementation, evaluation, and the proposed LGU Data Hub, will serve as the centralized data system of the municipal government, accessible for all concerned departments. The utilization and management of this portal will also be cascaded to the barangay, making them our partners to a more coherent and inclusive data management, leading to a more relevant policies and programs in the future. Public policy, public service is no room for shadow boxing. Our constituents deserve the delivery of programs that are relevant to them. And how can this be possible? If we will consult them, know who they are and what they need. This is where data-driven governance enters the equation, and it is where CBMS proved to be very helpful. In relation to this, as a global community, I know that we want to achieve the SDG so desperately. And before I end, I can only say that CBMS, like any other data system, will be of great help. It enables us to know where we are vulnerable and who we can empower to be our partners in fighting this menace called poverty. This is what I and the municipality of Carmona have learned through the years of using CBMS. I hope each and everyone around the world will follow our pursuit. Thank you very much, and God bless us.
Thank you, Congresswoman Loyola. Thank you for sharing your how you have used CBMS when you were the mayor of Carmona. Now we turn to another user of CBMS data, another policymaker. Senator Sherwin Gatchalian is a graduate of Bachelor of Science, major in Finance and Operations Management from Boston University in USA. His education became the platform from which he would launch a professional career in the private sector before joining the government. Senator Gatchalian is a member of the Senate of the Philippines. He has almost 2 decades of experience in public service. He's one of the lead proponents and authors for the enactment of the CBMS law in the country, known as Republic Act 11315 or Community-Based Monitoring System Act, which institutionalized CBMS in all cities and municipalities in the Philippines as a tool to generate necessary data for implementing poverty reduction and development programs. He adopted CBMS when he was the mayor of Valenzuela and used it for local planning and implementation of programs. Friends, let's listen to Senator Gatchalian.
Dr. Celia M. Reyes, CBMS Network Team Leader, members of the CBMS Network Office, friends, ladies and gentlemen, good morning and thank you for the opportunity to speak to you today. As your fellow advocate for good governance, I share your objective of building stronger systems for collecting data for evidence-based policy making. As we work hard to beat the COVID-19 pandemic, the value of having timely and reliable data cannot be overstated. This is evident in the implementation of programs that would give relief to our fellow Filipinos amid an economic crisis. We saw this in the distribution problems of the Social Amelioration Program, or SAP, of the Department of Social Welfare and Development. Last July, there were reports that the DSWD detected up to 81,000 duplicate cash aid beneficiaries. Up to now, the DSWD is yet to complete the latest tranche of subsidies under the SAP. When glitches happen in programs like these, it is our fellow Filipinos who bear the brunt. As we try to build back better from the COVID-19 pandemic, I share in your hope that deficiencies like this will be addressed by having community-based monitoring systems, or CBMS, in all government units. This is already mandated by Republic Act number 11315, or the Community-Based Monitoring Systems Act. I hope that in our recovery efforts, the government would leverage this law to be more efficient in planning, implementing, and monitoring programs for social protection and poverty alleviation. I'm also one with you in the hope that through laws like these, we can instill a stronger culture of planning in our government so we can help our countrymen live better lives. Thank you very much, and I wish you all a productive learning experience. Stay safe.
Thank you, Senator Gatchalian. We now have the open forum. We are joined live by Congressman Loyola from the Philippines, Dr. Mina Quay from Ghana, and Professor Happy Sifambe from Botswana. As I mentioned earlier, you can actually type in your questions in the Attendify chat box. Please state your organization and for whom the question is being addressed, and I will then read out your questions. So we have the first question from Herman Vargas Mesa, who's an Associate Program Specialist at IIEP UNESCO. And the question is, when working with geospatial data, particularly to map poverty, how is data privacy worked to avoid individual or collective identification of persons of colors? May I ask our panelists to turn on their videos so they can see you? And we're also joined in the panel by Mildred Purificacion, who's the Municipal Planning Officer of Carmona. So perhaps I can take the first crack at this, and then other people can perhaps respond to other panelists. So for geospatial, for CBMS, since it collects data for all households and individuals, one strategy to safeguard the data is there's differential access to data. So not all of the data that has been collected is actually available to everyone. So only program implementers have access to, for instance, list of names, addresses, and so forth. What is available to the rest would be aggregated data, perhaps at the village or even higher municipal or provincial level disaggregation. There are protocols that are being observed to ensure that data is actually secured. In addition, only selected indicators are actually generated and shared with the public, and these are primarily indicators relating to the different dimensions of poverty. So the intent really is for the database to be lodged at the local planning office and to be used by the different departments. So the repository at the local level would then process the data and share the necessary information to the different departments. I don't know whether the others would want to come in, but yes, Happy, would you want to share, Dr. Sifambe, how data privacy can be ensured?
Yes, thanks, Celia, and the listeners. I think you have covered it all. It's even when we collect it, it goes into the gadgets and gets deposited into a private place. We only share it sparingly with the local communities so that we do not, identify people that do not necessarily need to be identified. But otherwise, I think it's quite secure from my experience with the CBMS that we did for Gabani.
Okay. Now we turn to the next question. directed to Congresswoman Loyola, how is data collection funded in your particular case? I think you're muted, Congresswoman Loyola. Congresswoman Loyola, you have to unmute. Congresswoman Loyola. Yes. We cannot hear you, Congresswoman Loyola. Can somebody assist? Yes.
Can
Now
you
we
hear
can
me,
hear you.
Ma'am Celia?
Yes. Yes, we can
Yes.
hear you now.
Funding sources came from the local government unit. It was the local government who provided funds for the tablets, for the enumerators, for the training.
Did you okay, I don't know whether Mildred, the local planner, would want to add anything else?
Tumigato daw. Hindi marinig eh.
Okay. I think they're having Mildred, would you want to add anything?
Yes, ma'am. All expenses are being shouldered by the local government. While the tablets the national agency, the ILG, for 50 tablets for the data integrations.
Okay.
I think you are muted, Celia.
Okay, so we can ask our friend from our colleague from Ghana what she thinks could be the level of partnership or cooperation or resource sharing arrangement that can be pursued among key stakeholders in the implementation of CBMS. I will ask both from Ghana and also our colleague from Botswana what they think could be a good cost-sharing arrangement. Perhaps we can ask Nina first.
Thank you, Celia. Yeah, I think that for us, we have always been crying loud and clear about funding. But I think that our local government or governance system is localized. So at the local level, they are also allowed to come up with programs and budgets for the central government to consider resource mobilization and how to fund it. So for me, the very first step is the local people, putting this CBMS arrangement in their budget. Once it is planned for and targeted as very important assignment, then it's taken up at the higher level for consideration for funding. So this is the way I look at it. It should be funding from the government, but then the local people would then have to put it in their budget and planning that this is what we need because of the importance of data. Thank you.
Dr. Sipambe?
I think for us in Botswana, being an upper middle income country, the resourcing is more on the level of expertise and skills building rather than the financial side. So I think once we have an uptake from government, it will be easy for government to put in a significant amount of resources, given the importance of these tools in terms of monitoring and evaluation for them, which is quite a key issue. So I can see, if properly sold and marketed and arranged and made to be owned, or government see the bigger role of it, being something that government can fund through its usual budgets. And of course, you can also bring in some other partnerships from the international community, including UNDP and the other development partners who would be keen on the issue of developing the capacity, that is. So I think for us, it's more on the capacity building for the other partners in government, bringing the resources for the actual rolling out and so forth.
Thank you, Dr. Sipambe. There's another question from here for Dr. Sipambe. Can we have access to the study on youth unemployment using Markov and MNL models for reference? Where can we find it?
Yes, the study is available. We actually put it in the CBMS website, but we also have refined it, and it's one of the papers that we have just sent to a journal. We're waiting for review of the paper, and hopefully, if we are accepted, it will then be easily accessible to all through that forum. But otherwise, it is available in the website for the PEP, which I think Celia can provide at the end of this session.
Yes, all the relevant CBMS papers, research papers can actually be downloaded from the PEP website, and we will provide you the link at the end of the session. And you can also email us at the email address we've provided you in case you want, we want you for us to email you the papers. There's another question, suggestion here, PPP, private-public partnership arrangement for capacity building and funding. Yes, that's something that could be pursued because even the private sector can benefit from it. And in fact, it could also, the corporate social responsibility funds of private companies can also be tapped to support the initiative. There's also another question. How long did it take for Philippines to get the CBMS institutionalized? Let me just share that we developed the monitoring system as early as 1993, and that was under the MIMA project funded by the International Development Research Center of Canada, under the leadership of Dr. Randy Spence. And since then, we've refined the system, and with the support of still IDRC and DFID, through the Partnership for Economic Policy, PEP, we have been able to pilot test it in other countries as well. But in the case of the Philippines, the law was enacted only in 2019. So it took a long time to convince the national government to put it into law, to institutionalize it. But let me say that just like the case of Carmona, they didn't have to wait. They decided not to wait for a law to be enacted, and they have been implementing it using their own funds. So it was primarily demand driven, and they were willing to invest in it because they found the system to be useful. Another question is, what are the what are some important considerations for CBMS to be implemented and to realize its intended use? Perhaps I can ask any of our panelists to respond to that. How can we promote the adoption of CBMS by local government units, and for the CBMS data to be fully utilized by the local decision makers. Perhaps we can ask first Congresswoman Loyola to we can ask her why she decided to adopt CBMS, because she mentioned earlier that she used the funds of her municipality to implement it and has been implementing it for, I think, 5 rounds now. So perhaps we can ask her why she decided to implement CBMS. Congresswoman Loyola.
Yes, Ma'am Celia. We have seen the usefulness of data collection in addressing the gaps so that we can formulate policy. One important thing that came out from the CBMS was in 2011, when we noticed that we have so many informal settlers living in dangerous area zone, and we have seen the benefits that it has given to our community. So through the years, we have been motivating different municipalities to follow our pursuit, because we have seen the benefits that CBMS have given to our community. So one is the addressing of our informal settlers. The second, we were also identify the needs of our persons with disability. Through the years, it has proven that data generated through the CBMS was a useful tool to provide policies and programs to benefit all members of our community so that nobody should be left behind.
Thank you. Thank you. And related to that, perhaps I can also ask Dr. Mina Hui, in relation to the SDGs, how do you think can we advocate for the adoption of wider adoption of CBMS in Ghana? And then I'll ask the same question to Dr. Sifambe in the context of SDGs. Mina?
Thank you. Yeah, in the context of the SDGs, what is so critical is identify the people who really need support. The CBMS, it is just CBMS that can offer us that nitty-gritty of information needed at the local level, because SDG is not a national thing. The planning could be national, but then it's a so that nobody is left behind. It offers us opportunity to disaggregate data, especially getting the vulnerables, identifying them, and for effective targeting in our programming. And so for me, the very first time we shared our results with the policymakers, then they realized that no, we could also move it to the next level where we're giving the opportunity to, especially how we came by the multiple poverty index, to showcase the need for synergies and also making sure that resources are utilized wisely by taking care of these synergies. So that's what I can say for now.
Thank you, Mina. Dr. Sipake?
Yeah, I think for us, obviously the big issue with CBMS is its ability to complement data generation at very, disaggregated level, which our statistics Botswana is generating sometimes, after a very long period. And if we are to really achieve SDGs and monitor whether we are getting there, this is really a very good tool that I think for informed policy decision, would take us very far in terms of impact. The impact aspect of policy is what is missing in terms of our programming. And therefore, I think SDGs and also CBMS, this would allow us to get to where we're supposed to get and intervene timely when we need to. So I think the bigger issue for us in terms of promoting CBMS would be for us really educating the policymakers on its usefulness in terms of addressing that gap that they currently have. And I don't think if they are able to see the need and the usefulness of it, they would fail to fund it. They can, I think, from my point of view, if we are able to succeed in making it, marketing it effectively, government could co-fund probably together with other stakeholders like the private sector and the other development partners. So I think that could be my short answer to the issue.
Thank you. And for my last question, given that we're all coping now with the COVID-19 pandemic, how do you see CBMS as a tool for addressing the impacts of COVID-19 in terms of assisting our policymakers, our local officials in addressing the adverse impacts on the population? So some of you have mentioned a little bit, but perhaps now you can explain how CBMS data can probably be used by our program implementers. So probably I'll start with Congresswoman Loyola, and then Dr. Happy Sipambe, and then finally Mina. Congresswoman Loyola.
CBMS, yes, Ma'am Celia. CBMS was very useful during the implementation of our social amelioration program. Since we lack a national comprehensive database, the local government distributed subsidy to more than 13 households using the panel, the data that generated the vulnerable sectors. So because of that, we were able to prevent duplication. And besides, it has become more easier for us to distribute goods to the different vulnerable sectors because we can really identify where these sectors are located. So we don't need to go out, we don't need to go on census because we are on quarantine. So CBMS is very, very useful during the time of the pandemic.
Thank you, Congresswoman Loyola. Happy, how do you think CBMS data could help some of the local program implementers in Botswana?
Yeah, that's a very good question. As I said in my presentation, we don't seem to know exactly where the households that are vulnerable are. So when we have pandemics like COVID, where we need to target households rather than roll it out to everybody, it would have been very helpful if you had CBMS data, because it would just have targeted those households rather than giving out to everybody else. So I think going forward, that would have been a very good lesson. And I think we need to market it much more to close that gap, because it could have helped government in terms of intervention to deal with targeting issues.
And Mina?
I think the issue about effective targeting cannot be overemphasized. Effective targeting, effective targeting, effective targeting. And this calls for data. And we all know that there's always the challenge because we have the excuse of not having money to collect data. But it has become critical with the pandemic. You cannot do without it. The pandemic has taught us to be inward looking, to build capacity locally, to be committed to our own issues of development. And this you cannot do without data. And for me, that stresses more the importance of the CBMS data system, so that the local capacity will be built, so that the local people will know what is going on, and also follow up, do effective monitoring of interventions by development partners and also the government. This is what I would say: data, data, data. And for this, the answer is CBMS. Thank you.
Thank you, everyone. Unfortunately, we don't have time anymore for the questions. We would try to respond to them through emails, the other questions. At this point, we'd like to thank our speakers for sharing their expertise with us today. We would also like to thank all of those who joined us in this virtual conference. Let me also thank the organizers of the World Data Forum, the United Nations Statistics Division and its partners for providing us this platform for sharing our tool, the community-based monitoring system. And as has been highlighted by our presenters, the CBMS can be a useful tool for monitoring the SDGs and improving local governance. May I also thank my CBMS team for putting together this session. Additional inquiries about the presentations may also be forwarded to our email. And we also encourage everyone to visit the CBMS network booth at the virtual exhibition platform in Attendify. So thank you everyone for joining us, and we hope that this session has encouraged you to examine the possibility of adopting CBMS in your own countries. If we have seen how the policy makers have actually used the information, and so we're hoping that this session would have exposed you to the potentials of CBMS. So please contact us if you need additional information. So thank you, everyone. Can you just have to turn on our videos, Mina? Okay, so thank you, everyone, for joining us today.
Thank you, Celia. Thank you, and goodbye, everybody.
Bye. Thank you, everyone.